Imagine football, where every cheer, every story, every blade of grass counts. The Local Football Appreciation Awards celebrates not just the players, but the heart of our community. From the media to the groundsmen, from the fans to volunteers. Join us in honoring the real heroes behind the game. Celebrate football's true spirit together. Don't miss the event where every role is recognized, every effort appreciated.
Otio. Good morning, wherever you're watching us from. You're welcome to this special episode. My name is Richard Chimboa, your host. Most people call me Mr.Selfcare. It is a beautiful morning here in our studios, and we are glad to have you here today. If you're here for your very first time, please, we kindly ask you to subscribe, like, and comment. And please remember to share this important program with at least 10 people in your inbox or in your contact list. Today, we are privileged to have one of our own, one of our special people, my personal people, my personal friends, all the way from the Orange Nation, all the way from the land of plenty, that is South Africa. And we are going to be discussing a very important topic. You've all heard, we all grew up knowing that when you get things like cancer, it's like a death sentence. But today, this morning, we come to give you hope and the promise that there are now new sciences that can help us to slow down, that can help us to treat, that can help us to improve the lives of so many people that are actually suffering with cancer. Each time you go to hospital, doctors send you to do different investigations. Some are x-rays, some are ultrasound scan, which many people call CAT-TV, some are CT scan, the other people are sent to MRI. But little did we know that there is a new modality that is so important, that is so accurate when actually it comes to detecting diseases at a molecular level. Maybe some of you have not heard it because it's a new technology, or it's many of your doctors do not even know that it exists. But the reality and the truth is there is a new modality called nuclear medicine. So many people are calling it the new hope of Africa when it comes to diagnosis and the treatment of diseases at molecular levels, or at DNA level, or at cellular levels. Forget your other imaging modality that detects diseases actually when the entire organ has been damaged. We are talking about imaging at a cellular level. In studio with me is Dr. Palesa, all the way from South Africa. And Dr. Palesa, let me ask you to introduce yourself to our viewers.
Good morning, everyone. I am Dr. Palesa Kwatale. Thank you for having me today. I am from South Africa, and my background is I trained as a nuclear medicine scientist. So I do a lot of lab work, and in terms of my research also is focused in drug development. I also have a background in medical oncology clinical research, where I more focus in research and also in coordination of our oncology clinical trials.
Dr. Palesa, you're welcome. I know it's your very first time to be here with us, and thank you for being such a good friend. I remember that time when I was in South Africa, you were really helpful. I remember by then you were a young girl trying to do your PhD level. How is South Africa?
It's very cold where I'm at now and still dark, but yeah, I think.
Yes, and thank you so much for accepting to come and share with us some knowledge about nuclear medicine. Let us start actually from letter A as we move to letter Z of this nuclear medicine. Dr. Palesa, to gogo, I know in South Africa, gogo means a grandparents. To gogo in the village where you're coming from, and then to my Jaja from my village, Katent, where I come from. How do you explain nuclear medicine such that person from the lowest level can try to understand what it means? What is nuclear medicine? How would you explain it to a local person to understand it?
So in nuclear medicine, we define it as a very specialized field of radiology, in that we use very small radioactive material to examine the organ function and abnormalities.
Do you want that picture?
Yes, I am looking for that picture. Thank you. So what we are seeing here is that we are seeing what looks like an IV bag. So what we start with is that we inject a radioactive material into the patient's veins. There is another option as well, depending on what you are doing, that we are offering a radioactive tablet. And once the patient has received that, so imagine it as a drug that is looking for a plug in your body that is malfunctioning. And once we have administered that drug, and then we put you on a bed, that will be our scanner. So using the scanner, we are able to really trace, to really detect, how that drug moves in the body, and it will give you this beautiful image that you are seeing on the screen now, where we are seeing some blue and reds, and that will be the indication of our drug, how it's moving in the body. And if there are any, abnormalities, maybe like cancer or infection, or maybe some bone, where the cancer has spread it to the bone, we can pick up, some, the drug, distribution in those areas. So in that, we can actually, I think the advantage as well, this is happening in real time. So we are really able to see any abnormalities at a very cellular level.
Okay. Thank you so much. So in other words, you're saying that first of all, we have to introduce we introduce the drug into the patient, and then we give time for, in other words, you're saying, first of all, we introduce the drug, we inject the drug into the patient, like these normal IVs, right?
Yes.
And then we give the drug time to move into the patient's blood system. And afterwards, we take the patient into a machine that picks up images depending on the concentration of the drug into the patient. Beautiful. Dr. Palesa, how is this important? How is nuclear medicine important compared with other modalities that we have? Because to where I come from, I happen to serve in Mulago Hospital, National Referral Hospital, that is in Uganda, the biggest referral hospital in the country. And I work in the nuclear medicine. How is nuclear medicine better than the other modalities that have been in existence? For example, to many clinicians, they know for so many years they have asked for ultrasound scan, they have asked for X-ray, they have asked for CT. Last time we were here talking about MRI being used in imaging prolapse disc. So today we are talking about nuclear medicine. How is this important? Why is it considered the new ray of hope in Africa? Why are we giving so much fantasy and praise to this nuclear medicine? How is it advantageous compared to the pre-existing imaging modalities?
Thank you for that question. So I think what makes nuclear medicine special is that we can do diagnostics. So that is, we can, diagnose cancer, we can diagnose, infections, we can, diagnose, how your kidney functions or how your lung functions. So those, it just shows that it's very broad in application. And the other new interesting aspect that nuclear medicine has managed to bring into the field of medicine is what is termed theranostics. So not only are we diagnosing with with nuclear medicine,
Alexa,
but we
put on YouTube. Yes, please. Yes, Palesa?
Hello?
Please, yes, please. You can go on. We can hear you.
Okay. So as I was mentioning, the new development in nuclear medicine is what is termed theranostics. So what we are essentially are able to do, not only are we diagnosing, but we are also treating patients using nuclear medicine. So it offers an advantage that, if we pick up any abnormalities, maybe, for example, a patient have cancer, we can, confirm that there is cancer, and we can further not only further, if a patient has started, treatment, we can, with different theranostic treatments, we can also monitor if the patient is responding. So the application is very broad.
Thank you so much. So you've talked about a very important topic. When we talk actually about cancer treatment, to many of us, especially who are coming from some parts of the world or in other, like sub-Saharan Africa, each time we talk about cancer, we think it is a disease that once you're pronounced with cancer, there is no cure or no treatment. But what you've just said a few minutes back actually is a message of hope. That now when you're diagnosed with cancer, it doesn't mean that you're going to die. I remember when I was in South Africa, there was a program that were going on as far as actual treatment of prostate cancer is concerned using PSMA. And then so I remember leaving Prof. Mike was in the middle of a study about, I think, some skin cancer things. I've not read how the findings were, but this actually gives us some hope. It gives us new hope that actually now when you're diagnosed with cancer, there is hope that actually you can be treated. And then you've also said something important about
Theranostics.
Theranostics, that whereas other methods of treatment like radiotherapy, when you're taken there and maybe they are radiating you, there is no access to assess the degree by which your cancer is reducing or progressing. But the beauty now with nuclear medicine is that if you take me in for treatment in nuclear medicine, you can actually go on and do a study after the treatment to see, or after some time after the treatment, to see how I am progressing with my treatment. Don't you think that is actually a very important aspect of nuclear medicine when it comes to management of cancers and other diseases that actually where we are using it to treat them? So what are some of the modalities when we talk about nuclear medicine? When we talk about other modalities that are like ultrasound, X-ray, we can say we have chest X-rays, we have other. What are some of the common investigations that we normally have in nuclear medicine?
So the first one, I think that is the most simplest one that that we have, and it's widely available. It's what's called the bone planner scan.
Okay.
So the scan, it gives you a more of a 3D images. That is after the patient has been injected with any radioactive drug. We can produce images that are 2D. And it's very sensitive in detecting, bone metastasis, right? We use it mostly in that, especially this we see, in cases where, patient has cancer like the breast, we most likely to see bone mets there. And in prostate cancer, that's where it's used, where we want to see if there's no disease in the bone. And you can also use it in cases of infection. But one of the challenges and limitations using the scan is that it has very low resolution. So it means that it gives very poor anatomic images, in that we cannot really localize, in terms, the area of abnormality. So that's where now this CT comes in that it adds already to the advantage of the planner scan. One of the good things of the SPECT CT is that it gives 3D images, so we can see really a broader detail of the body in terms of organ function and abnormalities. And it gives a whole body scan as well, so we can image from the head to the toe. And it gives very good anatomic images. We can, localize as well the area of abnormality, because it is combined with already one of the most commonly used radiology scan, which is called a CT. So it gives us that detail of the anatomy of the patient. Not only are we able to detect physiologically at cellular level any abnormalities, but we can also, pair that with anatomic localization. So it really gives a very additive advantage. So in this case, the patient, might not need a CT. I know a lot of doctors or specialists might not really be forward when it comes to other diseases, but that's one of the advantages, that we can pair it with a CT. So we might not need to further expose the patient to radiation by doing an additional CT scan. And the other one, which is very common and the most hyped imaging modality in nuclear medicine, it's called a PET. So this is, I think, it's becoming the center of research as well, in that it is very sensitive. So we can detect, any abnormalities or any cancer at a very, small, details that wouldn't be picked by a SPECT CT or a bone scan. So, and it's because it's very sensitive. So that's why we like it, and that's why we like it very much. But one of the disadvantages with the PET is that it's very expensive. So unfortunately, not a lot of nuclear facilities might be able to afford this imaging, because it requires a very complex infrastructure to be in place. There's a lot of chemistry that's happening there. That's where my area of research in terms of drug development, trying to bring new drugs, radioactive drugs that can be more selective, because the chemistry there is very complex. So though that is one of the imaging modalities we have in place.
Okay, thank you so much. So from your explanation, you have said that number one, we have the bone scan that actually we use to scan the normal bone commonly used, and this is very important in actually imaging metastasis, like you put it. Now, to our clinicians out there, so many times you've diagnosed, for example, a primary tumor or primary cancer. For example, you've confirmed someone has prostate cancer, but you need to confirm how far has it moved from the primary tumor. And so many times you've sent our patients actually to some modalities that actually show little or nothing. I've seen people sent for chest X-ray. I've seen people sent for X-ray, for ultrasound scan to rule out metastases in the abdomen. But how specific and how accurate are those imaging modalities? So we are here to give you the great news that actually with nuclear medicine, you're easily going to locate these metastases, even in small quantities, in just a go. So when it comes to determining actually or detecting metastases in malignant cases, I believe nuclear medicine is the best. You've also talked about SPECT, where we combine this gamma camera or this bone scan with a CT scan, such that as this gamma camera or the ordinary bone scan is giving you concentration of showing you maybe the concentration at different level, the CT scan is giving you actually a 3D or a slight cut at that level. So you can now compare both. I think actually this brings about the admired accuracy when it comes to imaging. Imagine you're looking at something on a nuclear medicine, a screen showing the concentration of the radioactive material in the body, and at the same time you're getting a 3D whatever construction from a CT scan. I think actually it brings out the best of imaging, because just on one screen you're able to compare. It's just like reading a blood system on a CT scan of what is happening at that time. Then lastly, you've talked about PET scan, which we're now actually using to image a lot of things. This brings me to the next question for my clinicians out there. What is how do you choose the modality to use? When do I say that I'm going to ask for bone scan? When do I say I'm going to ask for SPECT? When do I ask for a PET scan?
So the choice of the modality that one would choose would really be directed by the clinical question. That is, what are we trying to confirm? What are we trying to rule out? So when we go onto the table to really see what will be best for the patient history in this case is very important to understand, from the history, what is for what is the condition of the patient, what the bloods, what other investigations like the ultrasound and the x-rays are communicating. Because some, for example, in oncology, these patients, they have really done other investigation prior to coming to do nuclear medicine. So it's very important that the clinical question is very well defined, and then it will be fed in by other additional investigations that have been done to say what were the findings, and from there what are we particularly looking to find. Like I think you have mentioned about in colon cancer, where patient might be going for surgery, but are we missing any lymph nodes? Because lymph nodes, we all have lymph nodes, but some lymph nodes, they might be carrying disease but appear very small on a CT, which will normally communicate that the lymph node is normal because it's normal in size. But if you feed in a nuclear a PET a scan, you'd realize that in fact this is not only a very small lymph node, but it has disease as well. Do we need to be taking out this lymph node so that we increase the overall survival of the patient and potentially get to a curative stage? So that's one of the things that it's a case-to-case basis, but that's one of the things that needs to be considered. And I think one of the most important thing as well, in a case where a patient is a female, we need to know whether this patient is pregnant or not, because pregnant patients cannot be subjected, to nuclear, techniques, because we know of radiation, although it is at a very small quantity, but the fetus is still developing. We do not want to subject the fetus to any radioactive exposure, because it might affect the development of the baby. And in that as well, you have to take in the strengths and the weaknesses of the different modalities, as we have discussed as well.
Thank you so much. Thank you so much for that. So in other words, you're saying that the patient presentation, condition, and the clinical question, or what the question that we want to answer, is going to determine if we need to refer this patient for bone scan, SPECT, or PET scan. Actually, you've also answered the next question that says, how do you select the appropriate investigation for this exam? So far with the experience, do you think our patients are gaining from the introduction of nuclear medicine? Because this is a very expensive modality. When you look at the whole of Africa, this week I've been interacting with friends from Egypt. I've also had a chance to speak to my boss, Mr. Richard Mbati, who is supposed to join us later on this show, about the state of nuclear medicine in Uganda. But everyone that you speak to acknowledges that it's a very expensive modality in terms of usables, because like in East Africa, we don't make any of these radioactive material. We have to import them from South Africa. And these radioactive materials actually have a time limit within which they are supposed to be used. So do you think the investment is worth?
That's a good question. I think without saying, it is one of the investments that should it's one of the modalities we should invest in. And I'm particularly saying this because I have an opportunity to sit in oncology meetings where we are seeing a lot of influx of oncology, because we know cancer, it's one of the top diseases that are affecting Africa, not only Africa, but the world at wide. It's one of our top interest diseases. So for example, you had mentioned prostate cancer. This is where we really see nuclear medicine really thriving and bringing the upfront benefits that other modalities are not seeing, because not only are we able to we are very selective in approach, in that we can really detect whole body wise the spread of the disease, and from those results we can select actually which patient will then benefit to go for theranostics. Because as I mentioned, that this nuclear medicine is very selective, it's very targeted. It is centered around what is now called personalized care, in that we treat each patient it's treated differently based on the presentation of the disease. So that's where we are seeing nuclear medicine thriving, in that we are able to target exactly where the disease is, and we are able not only to do that, we are able to provide a treatment as well, that we are in especially in metastatic setting where the disease is all over the body. We have seen miracles, what is now termed as miracles in nuclear medicine, where we are seeing patients really reaching a curative, a setup, so where we completely cure the patient. I think that such cases alone, because metastatic, when the disease has reached that advanced level, for most oncology patient, these patients, they go for best supportive care, or tender, or the other term that oncologists use, they say it's a TLC, tender love and care. It means the patient has reached a terminal point. But that's not the case with nuclear medicine. Now that we have it, it's not the case. We are able to cure our patients. There is hope for our patients. And as well, we can increase the overall survival of the patients and improve the quality of their life.
Wow. To friends in Uganda, I want to make this clear. Cancer kati ajjanjabwa. Cancer kati tusobola okumujjanjaba, era omuntu osobola okuwonera ddala cancer nga tukozesa nuclear medicine. Abaami abali eyo bonna olina omulwadde gwe baasanga ne prostate cancer, olina omulwadde oba muzeeyiwo oba neighbor bamugamba alina cancer. Cancer asobola okujjanjabwa kati nga tukozesa nuclear medicine ne bw'oba oli mu third stage. So wano we tuva ne tusabira bekikwatako ffenna okulaba nga we improve the funding in the nuclear medicine department, because there is new hope when it comes to cancer treatment with nuclear medicine. It takes us back to another point of discussion called patient care. Now, you've told us that actually what happens that I come to the department, you inject me with the radioactive material that eventually enters my blood. That means I am now a moving radioactive material, because my blood is filled with radioactive material. So how do we ensure patient safety and comfort to these patients, to make sure they don't run away, to make sure they don't get scared? Because we are talking about, when you talk about the word nuclear medicine, when you talk about nuclear medicine, so many people are scared. They call it, oh, how do you put that electricity in me? How do you put that in me? So how do we ensure patient safety? And how do we make sure that our patients are comfortable actually before we take them on for at these investigations. Because I remember the first time they told me that I'm going to study nuclear medicine, everyone was worried around me. Oh, you're going to die of cancer, or you're going to get this radiation. How do you ensure they are safe? And how do you ensure also the the people, the doctors around them are safe?
Thank you for that question. I think just a disclaimer, since well, I don't do a lot of patient care, I'm gonna need your expertise in that. But I think from my experience on the ground, and working with patients, is to really think like this about radiation. We are, throughout our life exposed to radiation, all the energies, the suns, all the things that which are part of our daily activities. We at some point are forced to do x-rays. Kids get, broke their their arms and all that, our phones, and so at one way or the other, we are exposed to radiation. So I don't think that it is something to really fear, because with nuclear medicine, we do have control measures in place, because it's very important to know how much of activity we are injecting in the body. So we do take care, take into consideration such measures, and it's very important to do patient counseling as well prior to any procedure, so that the patient is aware of what they are going through, and they can be very comfortable going through the process. So I think I prioritize patient counseling as the top front of patient care, and know how much you are injecting. We are saying that we are really, the radiation, it's very small, very small amount. So it's very important that we know how much we're injecting, and can the body of the patient handle such kind of amount of radioactivity. So there are very stringent control measures in place. And when we also inject these radioactive tracers, patients are in very not confined spaces, but we do put patients in rooms where they're not really walking around radioactive, because these radioactive material as well, they have what is termed a half-life, so they do not stay in the body for the whole day, or depending what you got. But in most of our daily scan procedures, most of the radioactive material that we inject, it has about 1 hour, or half-life and things like that. So we do take into consideration of that the patient is fit enough in terms of their renal function, that they are able to excrete these radioactive material, because they're not going to stay in your body for that long. I don't know if you want to add anything to what I've already mentioned.
Thank you so much. I think actually, basically, that is a very honest, good explanation. But basically, coming from the technical side, because at least I work in the department that handles the patient directly. Some of the things we do to make sure that there is patient safety. Number one, we make sure we don't handle patients like in a group. So we make sure each patient is seen alone. So a patient comes into the room, we have very good caring nurses in nuclear medicine department that always actually explain what the patient is going to expect, or what they should expect. We explain the procedures to them. We teach them a few things about the radioactive material we're about to inject into their body. We take their body weights, we take their heights, we look at the other parameters, we look at the physiology or the functionability of their organs like the kidneys and the liver that are supposed to break down or handle these radiations after. But also, so when we compile everything, we are ready to classify if a patient is fit for the suggested investigation or nuclear medicine treatment. And then after that, the patient is reviewed again by the doctors to again ascertain that they are fit for the investigations. We give them instructions on feeding, hydration, and all that. But on the D-Day, when they come for those investigations, we put them in separate rooms. We make sure a patient is alone, and then we introduce a cannula to them, and then we inject the radioactive material to them. To the operators or the medical personnel under them, they always put on protective gears, and they have been told to maintain a distance from the patient, because as we know, radiation strength reduces as you move away from the radioactive source. So this time we consider the patient as a radioactive material or source. So we put them in a room where they are isolated, with the calm rooms, no noise, and then they wait there, such that even if there is any radiation coming out of them, this radiation cannot meet another person passing in a nearby room. So these rooms are radioactive proof with lead, barium, paint, or any other suitable protective materials. But also after that, we make sure the patient does not go home immediately. The patient sits in the department, those well constructed rooms, to make sure we give it time to elapse, because for each of these radioactive material, we know the hours of activity. These materials have a short, what we call a short half-life, or a short period of activity. So for some of them, we know if we inject the patient maybe at this time, after these so many hours, like 2 or 3 hours, all the radioactive material in them is going to be totally maybe out or totally excreted, or it has been radiated. So this patient is safe to go back home and interact with the family. But still, even after that, we give some precautions when you go home, or do not use a public mean, or do not use. So some of them actually ask if they can have special transport to transport them back home, or things like that. So we make sure this patient is safe for himself, the family, but also the people around. But also, the other thing to ensure patient comfortability, we explain the procedures. We have visuals, we have videos that have been prepared. We have videos that have been prepared. We have people that have undergone the same. So all these are there to make sure the patient is in a comfortable position actually before they undergo this nuclear medicine. I've worked in the department of nuclear medicine. I have not come of a case of any radiation or any nuclear medicine technologist that maybe has died of things related to like the radioactive material. And also to let our viewers know, or people that are listening in, actually, these radiations are much safer compared to the other radiations that you know. If you compare exposure to maybe X-ray or CT in one go, maybe someone is safer off with nuclear medicine compared to them, because we give you a calculated dose in the smallest amount or smallest volume, just needed to give what we intend to do. We don't give you excess to go on radiating. Sometimes actually someone was saying that the doses we get from nuclear medicine are so small or minute that they are almost equivalent to what we'd be getting from nature. For people who stay around mountains that are continuously radiating, for people who are staying in some of tiled houses, there is now a new sign that some of your tiles actually radiate some of this radiation. So we make sure that you have a very safe dose for yourself. So that is that, explaining, but also taking precaution, and also having radioactive protective materials in the department is very, very key. And then, like Dr. Palesa said, that we make sure we screen for pregnancy in ladies in their reproductive age, to make sure that they are not pregnant while undergoing these investigations. Because whereas an adult lady can handle certain amount of dose, we are not sure how much the fetus is able to handle. So to do that, we make sure we totally screen out pregnancy before one goes for these investigations. So that's how that's what we do when it comes to patient safety, and then to make sure that actually doses are regulated within the department. So we are going to go for a 1-minute break, and then we shall be back to take on our last part of the day, and then we shall be happy to receive any of your questions depending on what you heard from us today. So if you have any question about what we've discussed, I know the science is complex, but throw in that question. We shall be happy to respond to you before you leave. As we go for break, I still want to thank all our viewers from all parts of the world, South Africa, I can see Nigerians here, friends from Uganda, and then UAE, and then my fellow students here in the US that are watching along. Thank you so much, and we shall be back after this break. Okay. Okay.
Imagine football, where every cheer, every story, every blade of grass counts. The Local Football Appreciation Awards celebrates not just the players, but the heart of our community. From the media to the groundsmen, from the fans to volunteers. Join us in honoring the real heroes behind the game. Celebrate football's true spirit together. Don't miss the event where every role is recognized, every effort appreciated.
Okay, we'll be back. Dr. Palesa, you're welcome to our second second and last. And I will start with this. What resources and support are available if the patient's condition is unexpected or complex? Okay. In case a patient needs a if the case is complex, how do we handle these cases? Do you work with other departments? Do you work with other specialties, or we are totally independent?
Thank you for the question. So because nuclear medicine, it's useful in management of different conditions that we have already mentioned, like oncology, infections, neurology as well. It's one of the biggest player there. So it's very used in management of very broad conditions. Therefore, in cases that are very unclear, which we as I've already mentioned, I sit in oncology, the unit. We do come across a lot of unclear cases, and therefore we do require, such cases require that they are brought up, or dealt in a very multidisciplinary approach. So a lot of departments, they do what they have, is what is called multidisciplinary teams. This is a team that is made up of different specialties, your oncologist, your physicians, your nuclear physicians, your radiologists as well. They do play a part, because it's nuclear medicine. It's not very isolated in nature. It feeds on into different specialties. So those teams needs to be in place, so that really the essence of what nuclear medicine is can really thrive. So we work in a very multidisciplinary approach in such cases.
Oh, sorry. So I was muted. So I was saying that, okay, sorry. I say that some, we don't work independent. We work with the rest, other teams within the department, because sometimes we have to rely on some lab values, readings from the laboratory before we proceed on with these patients. Most of our patients do not come specific at the nuclear medicine department. Some are coming in through the oncology clinic, some are coming through internal medicine, some are coming actually through surgical clinics and all that. So what we do in this case is that we cooperate with the rest of the department to make sure the patient is getting what actually they are supposed to get. For example, in imaging alone, there are images that we send to the radiologist to read. For example, where we are using SPECT CT, where we are having both bone images together with the CT image. We are going to refer the CT part radiologist to read, and then the nuclear medicine physicians are going to read the nuclear medicine part. Together, we combine it together to form a diagnostic report that we can send to the oncologist to direct or to help in treatment of these patients with some malignant cases. So really, nuclear medicine requires every team play. That's why when you go to this nuclear medicine, number one, they are very neat. I think I've not met any department in hospital that is as neat as nuclear medicine departments. For all the nuclear medicine departments I've been in, there are nurses that have been trained specifically to handle, so there is nursing care in there. There are technologists who are going to handle the patient when it comes to imaging. We have people who are working in the labs, the hot labs, to make sure the required radioactive materials actually are prepared in the safest manner for patient use. So all these people work in a team. You cannot be, whereas other clinics can be operated by one person, with nuclear medicine it's totally impossible for you to run, to say, I'm setting up my private clinic, I will sit there alone and do no. We need a lot of teamwork from different teams. And actually, this is how we are able to handle very complex patients, because the patient will come in, he has malignant issues, but also has maybe is diabetic, maybe has also glucose-related issues. So we are going to consult their doctors. We are going to look at the lab values. We are going to consult other people that have been managing him. We are going to consult the neurologist to see if the kidneys, we can go on and inject or and introduce any new drug into the blood system. Sometimes we may actually ask their primary doctors to come in the department and be present while we actually work on them. But also we are going to involve the support, the people that this patient stay with, because sometimes there are instructions we give them on the feeding, what to do before the examination, what to expect in the examination, for how long they are going to wait for them. So really it needs a collaborative effort from everyone to make sure the patient benefits from the services of nuclear medicine. So Dr. Palesa, again, you look very young. I don't know how you attained your PhD at that age, but congratulations again. I saw your graduation a few weeks back from my prestigious university, University of Pretoria, where I did my fellowship. So how do you stay up to date? Because when we are talking about nuclear medicine, we are talking about constant research almost on a daily basis. I remember when I was leaving Uganda to come to South Africa to do my fellowship in nuclear medicine, I left Uganda, my brain knowing the best that we had in nuclear medicine was a gamma camera. When I reached South Africa, I saw SPECT machines, I saw PET machine. But between the time I entered and the time I left South Africa, just in that period of 1 year, there has been a lot of achievement in terms of research and innovation. Almost everyone in the department was working on a breakthrough research. I remember leaving Professor Satege working on a treatment for skin cancer and things like that. So how do we stay up to date with the latest developments and innovation in nuclear medicine?
What should I say? I think, when I studied nuclear medicine, it should have been in 2019, if I'm correct. Then it looked like it was at its infancy stage. very limited to the lab because I do a lot of radio tracer, or rather I would call it radio, at drug development. I've been in exposed to the pharmaceutical drug development. Then I get to nuclear medicine where I need to continue that. It was very it's early stage. If I remember well, and in South Africa in particular, it was still slow growing. So I think what I realized is that nuclear medicine adopted what I will call a very the strategic approach, in that the approach is a bench, what we define as a bench to bed approach. So what does that mean is that every discovery from the lab that we have essentially has to be used for patient management. So we do value basic science that is translatable, to improve clinical practice, research quality, and patient care. So it's very important for us, because now it's the evolution, it's almost like moving at a very, it has picked up since when I started. So it's very important that you should continually invest in professional development. And that saying is that it, from the research perspective, is that it requires multidisciplinary collaboration, in that when we start to come up with an idea to treat or bring any treatment for example cancer, because that's one of the areas where we are actually looking to bring innovation, is that every specialty needs to be in board. That is your biologist. Your biologist will tell you that I think I have the next hot target in place, and your chemist will say, I can produce this drug and make it, amenable to be, attached to a radioactive, source, so that we can eventually trace it around the body. But what I've seen that is standing out with in terms of nuclear medicine, and what is really pushing the innovation at its level, is that we are seeing, a lot of, clinicians on board, what is termed now as clinician scientists. So those people, we have left them behind in drug development, but we are seeing them coming, from the start of an idea. So those are the people that once you say you had something that is promising, they say, I'm ready to take it on to the next patient, because the development process, it's very similar to what any drug will go to, really, where, we still need to test if the idea works, if the drug works, if it's promising, and then we take it to the animal stage, where, we do test it to see if we are able to see cancer that is maybe what we are interested in. And the most important thing that we still need to confirm is this drug, is it this radioactive drug, is it safe? So we do those tests very early at that early stage as well, to ensure safety. And once we do really see that the results at a preclinical level, that is, we are now using animals, that there is promise, then we are ready to transfer to patient. And that's where we actually seeing the benefit, of what really research, it's meant to benefit, our patients. So I think, keeping up to date, because there's a lot of, new information that is always out. It's important that we also, as researchers, identify the gaps in already existing information and improve on those.
Wow. So the way forward for nuclear medicine, though it is moving pretty fast, we really need to keep up with innovation, with research, and with the training. So that means this requires a collaborative effort between the medical schools that are training people. We need more people to come into the department. To the scientific researchers out there, we need more research into. And then, whereas we are specific or we are qualified in nuclear medicine, we need other people that are qualified in the drug manufacture, the radiopharmaceuticals, to come and join and put funds in this so that we develop more cheap, easily accessible, and yet very safe radioactive drugs to use. Because normally when we talk about drugs, and I tell people that nuclear medicine will have radiopharmacy section that makes our drugs, people do not think about that. But simply means that we need collaborative effort, we need research, and we need continuous funding. This takes me back to a question that has been sent to me by one of my students. What are some of the different professions within the nuclear medicine department? If you could easily break down, I think she's a new scientist that want to venture in. What are some of the different professions that we have? Because I know you are a biologist or something. You always telling me your titles, but when you study so many things, you now start to confuse us. So what are some of those different cadres that we may have in nuclear medicine?
Thank you for the question. So nuclear medicine is as broad as you can imagine. So I'm going to start, where actually we bring up a radioactive drug to life. So you will need your chemist, your nuclear, we term them the nuclear scientists. That will be what I do. So what I basically do, we are involved in manufacturing, we are involved, in chemistry, because it involves a lot of chemistry. So then after that, you do have now what is termed as radiopharmacists, right? That is, it's very exciting field as well, because that's where, we focused on the pharmacy related aspect of nuclear medicine, because it is a pharmacy aspect. And I must say there's quite a lot of still growth that needs to be, that needs to happen in that area in terms of nuclear. I think in Africa in particularly, that we need a lot of pharmacists trained as nuclear pharmacists, because these are the people that will ensure your quality control measures. Is your drug safe? Was it produced in a safe manner? If I have produced it, it still needs to go to quality control, and that's where our pharmacists come in to ensure for quality and things like that. They are also involved in production as well, in collaboration with the chemists, or rather I would say the scientists. And then from there you have what is termed the nuclear physicists, right? That is another booming area and interesting. I think when I see those people, I wonder, what they are up to. But basically what they area of specialty is that they look at the equipment, function, is the equipment, working properly. And the other aspect of it as well, they look at safety. They are the people that will come in after we've injected the patient with the radioactive material. They will look, they will monitor the patient. Is the radiation moving at a pace? Is it going out? Is it reducing in quality, in quantity? So they will measure the patient time again. And the other one, I think that will be the nuclear. I think they attempt nuclear technologies. If I'm not, they attempt the nuclear technologies. That will be our Mr.Selfcare here. That is his area of work in nuclear medicine. Those are the people then that, once the patient has received a radioactive material, we know that the patient, is safe. Then they go into the scans. Then the nuclear technologists, they are the ones that obtain those scans for us. They will, put the patient through the scans. They will do patient care as well, along with the nurses. I think there's another area that I'm not seeing it coming through, because I think that it should be a specialized field in nursing as well, because the care there, it's very different. But we do have nurses on the ground. But I think in terms of educational development, it's still not a specialty yet. If I'm correct, I stand to be corrected, but I'm not seeing it as being, as trained specialty. And then we have then our doctors. Then our doctors, once our technologists have obtained the scans, they now go through the scans. They are the one who reports on what is normal and what is not. And I think those, if I did not miss anything, those are the, the key role players and areas, of career that one could really thrive in.
Thank you so much, Dr. Palesa. And actually, this is a call to all young professionals in the medical world. There is still plenty of space in nuclear medicine. Whichever cadre you're doing, there is still a lot of space. I want to urge all my friends, the junior students in the radiography, especially from Uganda, where I come from. If you want to be special like me, if you want to be unique like me, if you want to be smart like me, nuclear medicine is going to offer you that space. And forget the confusion in the X-ray department. Forget the confusion in the ultrasound department. Come and be unique. Take on nuclear medicine. We need all of you. For the people that did pharmacy, you did pharmacy, but you feel you're not yet fulfilled. I'm telling you, you want to be special? Go join the smart people in the nuclear medicine world, and then be part of the fastest growing group of scientists that are developing almost a drug every day. Can you imagine that we have reached a stage in life where someone being diagnosed with prostate cancer and other types of cancer is no longer no longer death penalty, simply because a small group of people, the scientists, the biologists, the pharmacists, the doctors, are sitting down together to put their heads together to make sure they come up with radioactive drugs that will target where the cancer is. We put it in your blood, it will move in your blood, and it goes exactly to that point where the cancer is, will destroy the cancer. And after progressive treatments and supportive care, many people are receiving miracles of cancers being healed. And surprisingly, many of you, when you get healed, you go to churches and you give thanks and miracles, but you forget to mention that you passed via the nuclear medicine department. So I want to urge you all young scientists to come and join the fastest group of science in nuclear medicine. Next week, we are going to have, if she allows to be back here, we are going to be talking about radiopharmaceuticals and nuclear medicine equipment. She will be joined by other people from other parts of the continent. We want to see what takes place in the development of these. We want to understand the science. We are dedicating the next 4 weeks to nuclear medicine, because doctors we are writing to me, they don't understand nuclear medicine. They say, we want to use it, but we don't know how it works. We don't know its use. So this may not be so much for the patients, but I think this carries actually much more information to the rest of the medical world, to the doctors, to the primary health care that are handling patients, to the patient themselves that are being diagnosed with different cancers, to patient caretakers. Remember, like I always say, this program is meant to inform the African population about disease and healthcare. If we have much information, or if we have enough information about disease and healthcare, then we are going to be able to make informed decisions when it comes to healthcare service delivery. When it comes to appropriating or portioning budgets, we know where to put our resources because we know the results. And to the people in cancer treatment, I'm telling you, if you're running a cancer center anywhere in any part of the world, or Africa specifically, and you've not thought about establishing a well-functional nuclear medicine department, I believe you're doing your center and your country a disservice. So I kindly urge you, all our African leaders, all people that are funders, please put more money in nuclear medicine. Indeed, it is the new hope of Africa. Lastly, Palesa, as before I say goodbye to you, what are some of the biggest challenges that you think nuclear medicine is experiencing now? I don't want you to quote Palesa as whatever she's going to say is totally of what experience we've had either as students or as young professionals. I don't want you to say, oh, but you said this, oh, you forgot this challenge. No, whatever she's discussing at this point is just basically out of her experience as a young professional, given the book she has read, given what she has experienced. Palesa, what are some of the challenges you've experienced in the nuclear medicine department, or you think this beautiful science is facing currently?
I think one of the biggest challenges that is it is becoming a concern is that, there's currently a big boom of investment from pharmaceutical companies. And we know that is because this is mainly driven by profit, right? And I guess it's good because then it means there's some sort of development going on towards innovation. But I think it then brings a challenge to the question that can we actually continue to provide nuclear medicine access, either diagnostic or therapy at a very affordable price to our patients. And I'm particularly saying this because we are sitting in an African continent, and we have to be, we are aware of our challenges. Can we afford to even bring this technology and to the forefront in our countries, and to our patients at the price that they can afford. And I think it just speaks generally to our health care systems that are in place in different countries, because I know in Africa in particular that certain countries don't have any of nuclear services. And I think there was a publication that was released not just recently, where I think I saw it the number, it's very still few. I think in South Africa we are seeing a very high increase in having these services. I think I've seen in Nigeria as well. We do have in Egypt. I'm not sure in Uganda, Mr.Selfcare, if I did miss Uganda there, but it's progressing at a very slow pace in Africa in particularly. So I think now that we have the pharma space investing in that, can we continue to put up investment so that our patient can access these services, therapeutic and diagnostic services at a very affordable price.
I would love to add a voice to what my colleague has said. I want to pledge, I want to ask all funders that are funding healthcare, please, it is my humble appeal that you increase the funding, especially for the African continent when it comes to nuclear medicine. And at this point, I want to really appreciate IAE, that is International Atomic Energy, for what you've done. Most of us in Africa, our studying and training has really been funded by IAE through their offices in Vienna. We appreciate the offer you've done. I believe without you, many of African countries would not have any working nuclear medicine department. I've seen where I come from in Uganda, almost all the training, all the machines, of course, with the support of the government of Uganda. I really want also to thank the government of Uganda for all the effort and the leadership of Mulago Hospital for all the efforts that you've done to make sure the department is functional. We know it's a very expensive department, but we thank all the funders, private and government, for the collaborative effort you've made to make sure these actually departments run. We really seek and ask all African governments, as you're allocating funds for healthcare, allocate a special fund for nuclear medicine department, because this is a very expensive department and yet very functional, very helpful if we are looking at actually improving diagnosis and treatment of diseases at especially molecular or cellular level. In a special way, we want to I want to appreciate the department in South Africa led by, that is Steve Biko Hospital Nuclear Medicine Department, for allowing to train as many Africans or as many technologists, as many nuclear medicine specialists as possible. Because it's like my interaction with the majority of friends and colleagues from nuclear medicine department have had something to do with South Africa, especially at Steve Biko Hospital under the leadership of Professor Tegi. Prof, we thank you so much for actually standing in the gap and making sure that African scientists actually learn from you. You've taught us, you've advocated for nuclear medicine. Indeed, you're the father of nuclear medicine on the African continent, and without you, we don't know where this great specialty or professional would be. Lastly, on that, I still want to close by asking for more funding from NGO, more funding from the international community, more funding from governments, and more funding from all funders. Bill Gates, all those people that are funding, that are doing a lot of things for humanity. Please, the African continent still needs more funding when it comes to nuclear medicine. Definitely, there have been a hiccup with the recent cut of fundings from WHO, I think to atomic energy. And that has actually affected the trainings that were supposed to go on this year and some fundings. We clearly ask all policymakers at that level, please, the best thing you can do for African continent right now is to increase funding when it comes to nuclear medicine. Any short of funding is going to affect research, is going to affect medical supplies, because like my colleague has put it, it is one thing to come up with new innovation, but the cost at which these innovations are coming is way too high that they cannot be afforded by the local population in Africa. So one thing we can do is to actually ask funders to come in, fund the research, fund the production of these radiopharmaceuticals, help in purchasing this equipment such that the local people can have these services available to them at the least cost possible. Just like we've done in HIV, just like we've done in malaria, we believe the same can be done when it comes to nuclear medicine services. Palesa, before you go, where do you see the future of nuclear medicine in Africa in the next 10 years?
Oh, I think, there's quite innovation, a lot of innovation that is happening in space. And I think in Africa in particular, the innovation I see it in the area of infection. I think that's one of the areas that is still, a challenge in our countries, we're looking at TB, we're looking at, malaria. So we're looking at HIV. So I think there is still a big area of, development there, that I think that if we continue to invest in this area, it will really benefit, our communities at large. And we are yet to see a lot of innovation coming in that area. Of course, oncology will still, still be in the role, but what I've realized is that oncology has moved, faster, than, in the area of infections. So I think we should look up and continue to look at ways we can leverage nuclear medicine in pandemic, infection pandemic responses.
To our viewers, wherever you've been watching us from, I want to thank you for choosing to be with us this morning, this beautiful Sunday morning. It is about 8:27 Ugandan time. I know it's about 7:27 South African time. Wherever you're watching us from, thank you so much for choosing to be with us this morning. Dr. Palesa, I want to thank you for your time this morning. Thank you so much for being part of this show, where we talk about different healthcare innovations, different healthcare service provisions, different diseases, emerging diseases, and how we can improve healthcare on the African continent. Our role here is simple. This is to inform the population about healthcare. We believe this is going to help them make better informed decisions. We believe someone has learned something from today's show. But after learning, Nelson Mandela, the late, says, it is useless to learn and not to do. So we believe that whoever has had something is going to take an initiative to do one or two things about what they have learned today. Again, I'll quote Nelson Mandela saying, it always seems impossible until it's done. I believe that with the trend that we've started, with the innovation, the research, and the brilliant minds of the African people, we are going to be the new ray of hope in diagnosis and treatment. I want to thank you for listening in, but just before we close, I want to ask Dr. Palesa to send greetings to his people in what, is it Kezaren? Or where is that village that we normally used to go for Christmas?
Oh, in Plumho.
Where Gogo lives.
Yes.
Please send regards to your people in Broom something, and then I'll come back and close.
Thank you for having me.
Palesa, send greetings to your people in South Africa. Can you hear me?
Yes.
Okay.
Thank you. We will. Thank you.
You're welcome. To my fellow Ugandans, mwebale nnyo, mwebale kulya program eno paka sawa zino. Tusaba busabi nti bitwogedde tubitwale nga bikulu. Next week, we are going to be here again, same time, where we're going to be talking about radiopharmaceuticals and nuclear medicine equipment. Stay tuned. We want to give you more information about nuclear medicine in the 4 episodes. And then the week after that, we are going to look at the role of nuclear medicine in therapeutics and in diagnosis. We shall have more people come to dig more into that. And then lastly, we shall look at the state of nuclear medicine department in Uganda. Thank you so much, and have yourself a beautiful morning from me to you. Have a blessed Sunday, and God bless you. Bye.
Bye.